We were lucky enough to be able to do 2 training initiatives. So the first one was entitled Women Abuse in the Perinatal Period. And what we did was, our organization is a group of a number of different hospitals, community health centers, universities. So we have a number of different institutions within our partnership. And we decided, using that model of partnership and collaboration, that we would look at taking some training across the province, and entitled these endeavors Community Forums. So we targeted a number of forums within our own region, and then selected cities across the province to do community forums to raise awareness about the issue of women abuse, but particularly within the perinatal period. So we invited violence against women advocates, we invited obstetricians, we invited family practice physicians, nurses, midwives, mostly people that would be involved with women when they were pregnant, to come and talk to us about what it was they were doing, information they had about women abuse in the perinatal period. And then we did a little bit of a presentation just to sort of set the mood for the forum itself. Part of both of the initiatives actually was an ongoing training, if you will, and I would suggest that they were lectures and in-services and chatting with people, sort of, again, raising awareness of this issue. So there were lectures to university students, both nursing and medicine, both in the city I live in and other cities nearby. There were presentations at conferences. There were not webinars, but telehealth presentations using the Ontario Telemedicine Network. So our program is hooked into that media, and we do events every month. So one of those was on women abuse in the perinatal period. There were in-services in the neonatal unit. So when you looked at all of the learnings that were offered, or the opportunities, we seem to have reached, within the first initiative, just over 1,000 healthcare practitioners, whether they had the availability to get information through a lecture or read a newsletter or hear one of the lunch and learns and those other modalities. We think there was probably about 1,000 people who at least heard a little bit of the message about women abuse. One of the other opportunities we had certainly was to use some of the monies from the first initiative to partner with Best Start Resource Centre in Toronto, and to translate an existing information pamphlet that they had on abuse during pregnancy. So we translated it into, there was 2 Chinese dialects, 2 Aboriginal dialects, Somali, Punjabi, I believe, as well. So we had the opportunity to continue to sort of get the message out there to other communities as well, linguistic communities. So in terms of the impact for the participants, we were asked to do a pre and a post evaluation, and certainly the overwhelming response from the forums was very, very positive. There was an indication from many of the people that they would integrate some of the learnings from the day or the afternoon into their practice. In terms of our organization, because we don't interface with women who have been abused as our clients, our association or our organization, our clients are healthcare providers. And that's not to say that some of the women there don't have this as a personal event in their lives, but we don't interface with the women as our clients per se. So for us, it was a matter of being able to do some knowledge translation and awareness for the issue. The information that they were able to either take home from the forum Or potentially, I think the great value of the forums was the face-to-face connect with individuals in their community. So some women, or some of the players had been doing lots of great things, but really weren't aware of other groups that were working in their community as well. So I think that opportunity to network was a real benefit to the initiative and the community forums. Certainly, I think you go into the initiative, particularly when you have received some money from a granting institution and you want to do something that's going to show the value added from your work. And the grants, I think, or the proposals were ambitious at best. And you then need to sort of sit back and reflect about what maybe would have been realistic versus ideal for the grant money, and looking at timelines, because as much as you want, things don't always move as quickly or as smoothly as you would like them to. So organizing a group of people is challenging when you're trying to get different players to be available for a particular day, or identifying the key contact in the community and having them help you to organize the logistics of these meetings. I think that was one of the learnings, certainly, that although there was the best of intent for all of the things that we wanted to do, it was ambitious, and we didn't have a forum in all of the areas that we had suggested we would like to have had one. And some of that was that people had actually done their own initiatives just recently and felt that they were pretty up to speed on the training, so they wouldn't have benefit to a forum. But then looking the evaluation piece afterwards, sometimes because of the timing of the forum, we didn't have time to then do the 3-month follow-up. And actually, I think the original proposal was for a 6-month follow-up, so we had to abbreviate it to some in 3. And then, of course, you're relying on people to stay where they are so that you can contact them later and then have them give you their feedback afterwards. The evaluation piece was a challenge. The staying power, I think, and we talked about that earlier today, was to build it in right up front. And I think that for this first initiative, the sustainability will lay within the domestic violence coordinating committees that already exist in some of the communities. And if it didn't, then you need to think about champions. You need to think about your opinion leaders. You need to really strategically place the people around the table and include the detractors as well. So you want a little bit of tension in that group so that the conversation and the debate sort of continues. The second one was we were invited to develop some online learning modules, and that was in a conjunction with another project that was going on. And because that project didn't have any modules that were specifically related to the perinatal period, we were asked to develop 2 modules that specifically addressed issues around pregnancy and immediate post-birth. And we decided, looking from our steering committee, looking at the 6-week follow-up appointment. So we had modules. The first module was called New Babies, New Worries, and addressed some of the issues bringing a new baby home into an environment where there may be abuse or violence. And then the second module was called Postpartum Blues and Bruises. So looking at how a practitioner could potentially identify a woman when she brought her baby back for that 6-week follow-up appointment.